Hello and welcome to the Community Voice. I'm Fara Sachs. I'm so happy you're here with me today, Dr. Aimee Gonzalez. She is the Chief Medical Officer for Keralty Hospital.
Thank you for having me.
What's that like, being female and the Chief Medical Officer?
We're going to start with that, are we?
Yeah, let's talk. Your journey is very interesting. So take me through the journey and how we got to this moment today that we're talking, because it's been 2 years.
We've had a good 2 years. We've done a lot of good with the hospital. We've opened our emergency room to 911, and walk-ins are welcome. We've restaffed the hospital with board-certified ER physicians. Our wait times are great. The attention is great. The time to get you into a room and get you settled down or get you home is equally great. I think the whole idea is to make sure that once you come in, that we streamline the process so you're not waiting in a waiting room waiting for care. We've also made new improvements with community outreach. We have a liaison officer that is in charge of going out there and finding resources that we can offer our patients. We try to identify patients that have difficulty with their home setup, their support system, with loneliness, with getting out in the community and meeting people, and that's been very successful as well. We're working with our foundation, which is Compassionate Communities, to identify people that may need assistance and offer them the assistance that they need.
Talk to me about you, this journey.
This journey has been exciting. So being a woman, let's get back to that. So being a woman in this
I'm glad you didn't forget the question. I'm glad we went back through the back door and roundabout again.
Yeah, so being a physician, being administrative, I think is the thing, is difficult. I think it's still very challenging to be a woman in this field that is generally held by men. I mean, we have great female directors at the hospital, people that I respect so much and that do such a great job with their hearts and their brains, and they give such good care. And we as a unit work so well. Women work so well together. You know, we are caring, we are detailed, we are hardworking, we're dedicated. We always assume responsibility, maybe sometimes too much responsibility for what we do. And we are great team players, and that makes me very proud, not only to be a woman, but to be in this particular facility where we have such great ones. And
it's to have that female energy and
yes,
to be sensitive to the whole operations. I think that's really, really important.
100%. And I don't think anybody does it better than a woman. That being said, it is still a man's world, and it is a challenge when you have such a diverse city that has so many people coming from so many different places, that have so many ingrown beliefs about a woman's capability and place. It becomes a very big challenge. I think I've worked all my life to try to break down those barriers, but they still exist. They're still out there.
Where did you grow up?
I grew up here.
You grew up here.
In Kendall.
You grew up in Kendall. Where'd you go to high school?
I went to St. Brendan High School.
So as a local grown, how have you seen the community change and the dynamic in its population? And how did you bring that to healthcare and your current job?
I think being culturally sensitive is very key. And I think I've said this before, that people, before it was all Cubans, right? Mostly Cubans. And now we have an influx of so many other people that are going through hardships in their own countries that come here for asylum, to seek help, for family, for jobs. And it's made the city what it is today, which is great, because all these improvements have come because of the influx of different talent and different resources. And I think that makes the city so special. At the same time, it's been such a challenge to deal with all these different cultural beliefs and habits. And I think you have to be very in tune with that. Patients need to feel like you understand where they come from. And we also need to understand that being Cuban is not like being Colombian, and being Colombian is not like being Peruvian. And we all have our different sets, not only their economic status in the world, but their professions, how they were brought up, their religious affiliations, their personal beliefs about so many things. So being sensitive is key, and now you have to be more sensitive than ever.
And absolutely. And in Keralty, you're bringing all of this community together. So here we are 2 years from the last time I had you in that hot seat. And so let's talk about some of the changes and how you've morphed from Westchester Hospital to Keralty Hospital, and how things are changing and moving forward to address just the different dynamics, the diversity in our community, and watching the city of the hospital grow up into its own little city almost. So here we are at the front door of the hospital. Mm-hmm. Tell me.
We've done so many improvements. I mean, as you can see, the hospital looks so beautiful inside and outside. We dedicate ourselves to make sure it's welcoming and clean and smells good, and that you have an entire team that receives you and makes you feel like you're welcome there. If you have any trouble finding any service, we're there to guide you. This is the emergency room. As you can see, we're open to 911, so we get frequent calls daily from 911.
When did you open up to the...
That was in February of last year, I believe in 2023. And it's been pretty busy since then. And that, of course, has brought more availability to the ER to people around the community. So we are open to walk-ins. We'll see peds, we'll see OB. Whatever you need, we're there, and our physicians are totally staffed and capable of attending to your needs. Now, if you're going to be admitted and it's something more serious, we will transport you out, but your immediate needs will be taken care of at the hospital.
What do you serve? What do you serve? What kind of services are provided during that board? It's a board certified ER. So
Yes.
tell me what that means.
And we serve primarily over 18, although again, we can see everything. Because our board certified physicians are able to see the entire scope of medical practice. We do cater to the over 18 group. We work closely with other hospitals in the community in case there's a needed transfer, but we offer interventional radiology.
What is that? Let's talk about that and how that serves a community.
That is thyroid biopsies, liver biopsies, thrombectomies, which is when you have a clot in your leg and they need to get it out, or they need to do some interventional procedure to try to get it out. If you have fluid in your lungs, fluid in your belly. Dr. D'Angelo is the head of our interventional radiology department, and he's absolutely awesome. Everyone that meets him loves him. He's just super confident, loves his patients, and he's always a happy guy.
And you also address sleep apnea, and you perform
And now
sleep
we're opening
studies.
up a sleep apnea center.
So therefore, the spouse or the significant other will sleep well
sleep
with these
well.
Studies.
Yes.
So what does that mean when someone has sleep apnea or snoring, and how
Sleep
you
apnea
treat
is
that at the hospital?
It's so prevalent in our country right now because
Causes?
it's related to the obesity rate. It's also related to the rate of hypertension, stress, and it can worsen a lot of chronic diseases like hypertension, diabetes, longevity, wellness. So it's something that we really want to address because it's so prevalent in our community. So we're opening up a sleep apnea center. So we're going to be doing high-risk patients at the hospital. Although some of those will always be done at home when possible. But for those high-risk patients, we want to offer a safe environment where those sleep apnea studies can occur.
And how does this affect the patient care and the hospital operations with all of this new and improved?
It's fun. There's a lot of movement, a lot of dynamics, but we're making it work. I think we're a small hospital, and I think these services are very crucial because we know as a small hospital that we don't want to fill the hospital necessarily with patients that are sick. We want to be able to keep you from getting sick and keep you at home.
And what are we looking at here? What is that?
This is the entrance of the hospital. This is our waiting room. As you can see, we did a complete overhaul. It looks so pretty, peaceful.
And how many beds are in the hospital?
We have 127 beds. 27 beds are psychiatric inpatient beds.
Let's talk about that. Let's talk about the mental health issues. Let's talk about how you're servicing in the community, what you're seeing in the last 2 years since we last talked. So we came out of COVID, and what people were dealing with then. It was post-traumatic stress. And where are we now? And how many beds are just dedicated to the mental health?
So we have 27 beds, but we also have a dual diagnosis area where we admit people that have both medical problems that are ongoing and also acute psychiatric problems. It's become so prevalent. I think that after COVID, we saw a big surge in problems with mental health, people being isolated, having no social support, being sick, long COVID. All those things have created an uprising in that problem. And we are one of the few hospitals that is continuing to serve that community because a lot of hospitals have let their inpatient units. They still have inpatient units, but they don't do acute care when it comes to like involuntary admissions. And so we are hoping that we can continue to serve our patients by offering that particular service.
So with this care, is this you're there for 3 days, you're there for 5 days? How long can a
average
patient?
is 6.5 days. It can be longer, or it can be shorter.
And then you put them into another facility, or
Yes.
they're released back into.
Once your acute episode or problem is corrected or managed, then we try to place them either in their own home with relatives or caregivers or independent facilities or assisted living facilities or even the state hospital when necessary.
And is there a return rate for you, or
It's
basic?
pretty good. I mean, a lot of our patients are recurrent because it is such an ongoing problem, and once you place them, it's very difficult to control the medication and all of that. So we do see some return, but overall our rate is really really good. And I think our doctors do a great job of following up with them.
And speaking of doctors, let's talk about the new physicians. And with any good family, they grow.
Yes.
So we have growth happening at the hospital.
We have a lot of new up and coming physicians that are great.
So let's talk about some of them. And we have some pictures.
This is Dr. Alain Ardiles, who is in our emergency room. Great guy, great bedside manner.
He looks about 14 years old.
I know, they're getting younger because I think we're getting older. But he does a great job. And this is Dr. Osmani D'Angelo, which I talked about earlier. He does our interventional radiology. As you can see, he's always happy.
He does look happy.
This is Dr. Pereira. She is also new to us. She's been around for a little bit, maybe a year now. And she is our medical director for our inpatient unit, and she is absolutely great. She does great with teenagers and young people. She can relate to them, she understands them, and she takes all of it very seriously. And honestly, she is amazing.
With your 125 beds, how many physicians and staff members are there?
We have about 180 physicians on staff.
Wow. And we have one more doctor that
Dr. Fara.
I would be remiss.
This is our gastroenterologist who works like crazy to make sure that all our patients that come in with acute GI problems get seen promptly and quickly so they can get back to their lives. He's great. We also have a colonoscopy program that he heads as well at the hospital for preventive care.
Oh, wonderful, wonderful. And then we have
Dr. Joseph Raymond, who's our cardiologist, who's a great guy.
You smile and you laugh about him.
He also very likable, great bedside manner, great knowledge. Awesome. That's all I can say. And Dr. Roddy is the champion of the year. He is our director of emergency medicine. He staffs our ER through his company, which is Synergy Medical Collective, and has restaffed all of our ER. And it's just been an amazing experience.
And it's really interesting because they're young, it's fresh, it's very vibrant, and probably cutting edge information and technologies for procedures and for care.
They're eager, they're not tired, they're willing to help you, they're willing to help each other. It's really a great team.
And then there's an adopted motto. Caring for patients at home approach. Let's talk about that initiative and how that's working and what that means for the community.
So that goes back to what I was saying about not filling the hospital necessarily with care if we can keep you at home. It's trying to do other services that will help you stay at home, like care at home, hospital at home.
What is that? What are those? What would that? When does someone know to stay home and when I need to go to the hospital?
We will do the initial visit at the hospital, whether in the ER or on the floor. And then if we deem that this is something that you would be best served at home, where the doctor, the nurse goes to you, where the medications go to you, where you can stay with your immediate circle of support, then we try to keep you there. And then you'll work with our team to do just that. Home health care, of course, will not involve a physician so much as ancillary care, wound care, medication administration, and things like that. Also to shorten your hospital stay so that you can get back to your family.
That's a beautiful thing. And how successful has that been for you and for the families?
We know when you try to disrupt healthcare a little bit, you get a little pushback. But I think, we want to make sure that the patients feel safe and that the doctors know that their patients are safe. So it's about re-educating, reinventing the way things are done for a better way. And slowly but surely, we're making headway.
That's wonderful. And in 2024, this is exciting. Your residency program has graduated from the hospital.
Year.
I feel like it's like children. You're like letting children out. So let's talk about what we're looking at here and about the festivities. Everybody looks so happy because they work so hard.
They work so hard to get here, and they're absolutely great. So we have Dr. Mario Solana on the right, or is that the left? The right. Dr. Jose Suarez, Dr. Yen Flores, Dr. Yana Maggio, myself, Dr. Michael Lopez, and Dr. Avnish Jetty. These are all third-year graduating physicians from our family medicine program. Most of them, if not all, I believe all of them will be staying local, which is great because we just contributed to 6 really good physicians that are available to see our community.
That's really wonderful to help more people that might be needing services.
Yes.
And you're really centrally located.
Yes. We are. And our area is in very high need of having a community hospital, somewhere where you can go, where you feel comfortable, where you know the people there, where they're friendly, where you're not lost in this maze of bureaucracy. And you're
in 75th Avenue and 25th.
And 25th, right off the Palmetto. So very easy access. We have a parking lot about a block away where you get shuttled in, and that's every 10 or 15 minutes. So it's super convenient.
And I'm going to give just a quick shout out. It's keraltyhospital.com, or the phone number is 305-264-5252 for more information.
And join us on Instagram, where you can see not stock pictures, but our real physicians and our real staff, so you can get to know them.
Oh, that's wonderful. That's wonderful. And let's talk about the outreach initiatives that are partnering currently with the hospital at Keralty.
So we partner with Miami Rescue Mission.
And tell me what they do and who they are and what you do with them.
They give meals and care to our homeless population. We've been involved with them for at least 5 years, if not 6 years. We're also partnered with the Chapman Center that also houses, feeds, clothes, and has a lot of outreach for their community of homeless.
They do beautiful work.
They do great work. And we've done a program where we check their feet. We provide shoes, fittings for diabetic patients and patients with difficulty ambulating. So that's been very challenging. It's been great. It's been very rewarding. And the residents have done that several times.
Now let's talk about the research center at Keralty.
And research. So our research center right now is involved in a big study for preventive care. Colonoscopy specifically, which is very important to us because that's one of our huge initiatives and our push, because as you know, colon cancer is becoming a big problem for younger people. So we're trying to capture younger people when it's even more treatable.
How young?
Well, it depends on your family history, but it can be as young as 20, 25, 30.
So like mammogram?
Yes.
Will insurance cover if there's a history of
100%.
Colon cancer, polyps, Okay.
Now, there's always a copay, but for screening for screening colonoscopy, there is not. So,
what's a screening?
Screening is when you are getting checked because you're due for your age, and not necessarily for a high risk factor. So, it's something that we should all do.
Okay. So, is it a silent? It
can be very silent.
Does it show symptoms? Let's talk about the silent, and let's talk about the real in your face, I don't feel good, there's something really wrong and I have to go to a gastroenterologist, there's a problem.
So colon cancer can show symptoms way after the onset of the disease, which is the tricky part. So you can have diarrhea, constipation, blood in your stools, abdominal pain, weight loss. But in the early stages, especially when you're younger, it can be very insidious and you may not have any complaints at all. And so that's why it's important to talk to your doctor, examine your risk factors, talk about your symptoms. I think that when you're young, you think, oh, it can't be anything bad, but unfortunately, it can be. And so just being close to your physician and having somebody that you can talk to that can explain to you the risk factors and signs to watch for is very important. Not only for that, but for breast cancer, which we're also finding. We're getting better at finding it too. And other diseases,
Why are we getting better? Is it the technology? Is it people more, they're aware, they do their Google search and say, oh, well, I'm able to really research and be more proactive about my own health?
Yes, I think that the way we look at health and wellness is changing with this new generation. I think they're more proactive. I think that it's more in the media. I think there's more literature out there. Medicine has become a science for everyone. Not some secret that your doctor hoards over you. I think that's very important. But I also think that people are smarter. They read. Yeah, they access this information, and they're better able to answer their own questions and reach out when they can't.
And so I've got a question before we went on. It was about to ask you about gastroenterology department, and it was about IBS, colitis, and that whole sequencing. Is that a cause of cancer, stomach cancer, colon cancer, rectal cancer? Is it a higher incident?
So IBS.
Thank you for the question.
IBS encompasses all the inflammatory bowel diseases like irritable bowel syndrome, which does not have any correlation with increased risk of cancer. But there are other diseases like Crohn's disease, ulcerative colitis, that either can lead to or can have other manifestations like adhesions, blockages that need to be addressed more aggressively. IBS, however, is also growing in this generation. I think it has to do with mental wellness. It has to do with your diet. It has to do with anxiety. So I think there's it's multifactorial, but it's something that should be addressed with your doctor because it does get better and it can get better.
So this has also a component of mental
Yes.
awareness or discomfort,
and there's a lot of things that we can
anxiety.
do to treat it. We have a lot of tools in our toolbox that we can try to make you feel better.
John, I hope that really helps you. Thank you for the question. We're talking again now. Let's go to the Diagnostic Imaging Center.
So we offer diagnostics for the community. So mostly a CAT scan, like I said, the biopsies. We also offer a mammogram, colonoscopies, X-ray, plain X-rays, CTs with and without, barium studies as well. Ultrasound, thank you.
Paola's great in the background there.
And that's been growing as well. We try to make it easy. You're in and out. Appointments are readily available within 1 or 2 days so that you don't have to spend an hour worrying about, or a month worrying about if there's anything wrong.
No, I'm not going to let you wait 2 years until you come back because we've seen each other so many times in between. But what are the plans or initiatives for the future for Keralty that our audience might love to know more about?
Well, definitely we want to grow. We want to offer more services to our patients in the entire scope of practice, palliative care, hospice care. That is something that we would like to expand on. We also want to grow our hospital at home program. We would also like to offer specialty care, not only through our GI and our cardiology, but also rheumatological care, more specialized cardiac care, stroke unit. All of those things are things that we're looking forward to in the next couple of years.
Last question. What gets you up in the morning? What excites you?
Waking up every day and trying to make a difference and seeing the people that I work for that are very important for me to get that dream done.
And talk about some of those people.
Oh, wow.
How have they changed your life? How have you changed their lives?
I think that very few times in your life do you get to work with a team that you truly respect, that are supportive of each other, and no one's taking credit or stealing ideas. It's all just about working together towards a common goal, which is how it should be always. Mary Valdez, from the front desk person, Helen Flores, all the way to the surgical units and what makes it work. Our CNO, Mercedes Perez, who is amazing. Our nursing supervisor, Ana Grillo. I mean, there's so many wonderful people, from medical records all the way down to HR, to the maintenance crew, Margarita, who does a great job getting my office prepped for the day and getting our conference room nice and pretty. I mean, it takes a lot of people to make it successful, and they do a great job. I commend them every day for getting up and doing it.
And you're the head, the face.
I'm honored to be that. Yes.
And I'm glad you're sitting at the table.
Thank you.
And for being in our community, Dr. Aimee Gonzalez, Chief Medical Officer at Keralty Hospital, thank you so much for joining me today.
Thank you, Fara.
And for more information, it's keraltyhospital.com, or you can call them at 305-264-5252. Thank you. Continued growth. And I want you to come back, and I want to hear more wonderful things that are happening.
Definitely.
Have a great day, okay?
Thank you. You too.
And I want to thank you for joining me today on Fara Sachs. Until next time, take care of yourselves and each other.